Good afternoon, everyone. Welcome to the second webinar in our September Symposium series on cognition and Parkinson's. Today, occupational therapist Lisa Wechzelberger will be speaking on the impact of cognitive decline on daily living. My name is Alana Dillon. I'm an Education and Support Services Coordinator at Parkinson Society BC, and I'll be facilitating our webinar today. Before I introduce Lisa, I'd like to go through a few housekeeping items with you. First, I want to let you know that we are recording this webinar, and it, along with the presentation slides, will be available on our website. Your videos are turned off and mics muted to prevent any interference in the presentation. Secondly, you will see a chat box at the right-hand side of your screen. Feel free to use this chat box during the webinar to make any comments or questions on today's presentation topic. Lisa will address the questions at the very end of the presentation. Sometimes the chat box is at the bottom bar. There will be a chat bubble icon. If you click on that, the chat box will expand. And finally, to optimize your experience with this webinar, please ensure that you adjust your speaker volume both on your computer as well as on your actual speakers so that you can hear the webinar well. And if you are experiencing audio issues, please ensure that you haven't pressed your mute button on your keyboard. And if you continue to experience audio or video freezing or interference, please refresh your browser. That usually resolves the issue. If that doesn't work, please log out and log back in. I'd now like to introduce Lisa Wechzelberger. Lisa graduated with a Master's of Science in Occupational Therapy from the University of Toronto in 2007. She moved to BC and began working in acute care at Surrey Memorial Hospital and later worked on the high intensity rehab unit. She moved to the outpatient neurology clinic at Jim Pattison Outpatient Care and Surgery Center 10 years ago when the clinic expanded. Lisa has had the privilege to work on a multidisciplinary team in the neurology clinic with a focus on helping people with Parkinson's disease. She has learned a wealth of knowledge about Parkinson's disease, treatment, and long-term management. Lisa, welcome, and thanks for speaking for us today. I will pass it over to you now.
Okay, thank you very much for the lovely introduction. I don't have to do much more for that, but my name is Lisa Wechzelberger. I am an occupational therapist. And I work through Fraser Health in the outpatient neurology clinic. And just like Alana said, I do work with a multidisciplinary team, including several movement disorder doctors, as well as a physiotherapist, a speech therapist, and a social worker. And today I'm going to talk about cognition and the role of occupational therapy. So to start with, I just want to describe what occupational therapy is or what occupational therapists do. At times, I may refer to occupational therapists as OTs, as is commonly known. So OTs focus on function, and function is all about the things that we do in our day. I know many people, when I first meet them, they think I'm going to get them a job or make them go to work. That's not the case. We're looking at everything that people do in their day. I'm trained, and all occupational therapists are trained to assess, treat, and help to manage people's daily activities after an injury or illness. This can include how you manage your personal care, how you are managing household roles and things you do at home, how your mobility is related to how you're able to do things. And most importantly, I also look at cognition and how that impacts every aspect of your life. So, and I know Dr. Hanel, if you were at the session last week, Dr. Claire Hanel went over more of the medical model of cognition and the different diagnoses that can happen with that. Today, I'm just going to focus more on the different pieces of cognition. So the word cognition is generally used to describe how the brain works, excuse me, and this generally involves things like attention, and this also, attention is multi-layered. You have just focused attention, which is what you're doing right now. And then you can have divided attention. Divided attention is when you're trying to focus on more than one thing. So this might be something you're doing right now. You're watching the presentation. You might be eating. You might be doing another task. Memory is quite complex as well. There's three main parts to memory. We have the ability to pay attention, as I had said, store the information, and then most importantly, retrieve the information. Another part of cognition is how we process information. And you'll hear me talk a little bit more about the speed of processing, as this can change with cognitive challenges. Visual perception is also part of cognition. So vision is how the eye sees, and then visual perception is how the brain understands visual information. And then lastly, I just want to touch on that also all linked in with cognition is the concept of executive functioning. Executive functioning, we sort of refer to this as the boss of the brain. This is where the functions for making decisions, planning, organizing, initiation, as well as stopping an activity, impulse control, and flexible thinking. So as you can imagine, cognition is already, as I go through this small list, very complex. And I've learned over my many years of work, different avenues to help with cognitive challenges. So today, of course, I'm going to talk about things that we can do to help our cognition, but I do want to go through some of the common problems I see for people with Parkinson's. First up is memory problems. This is normally to do with short-term memory. So short-term memory is the things that we've done in the recent past. So today, yesterday, versus long-term memories are things that we did many years ago. And often I hear people say, well, I can't remember what I did this morning, but I can remember something I did 30 years ago. This is very common with just how the memories are stored in the brain. Another problem I see quite often is multitasking. So multitasking is simply paying attention to more than one thing at the same time. And often somebody with Parkinson's, if they're having cognitive problems, it can look like they're having problems switching attention. They can't do two things at once, or it's just that processing speed that everything is taking a little bit longer. Some examples of multitasking that I often talk about in my clinic are things like walking and talking. They are often when I go out to meet patients in the waiting room, they're trying to put their cell phone or a book in their bag or their pocket while they're walking. That's multitasking. We're trying to do two things at once. Now, as I mentioned, processing speed. How quickly the brain understands information really impacts how we manage day to day. I find that as often as Parkinson's progresses, this processing speed slows down. And so again, what that means is, if we're having a conversation, or even just as you're listening to this presentation, I've already moved on to the next point, but your brain may be still focused on the previous point or the previous conversation. And so this can become one, very frustrating for both patients and family members, but also just it creates problems with memory because you don't remember all of the pieces. Sometimes I do have people that have confusion. I would say that confusion is actually quite rare for what I see. And often it's minor confusion that we're looking at. And confusion can be things like forgetting how to do basic things that you've done in the past, just sort of get mixed up with how to do things. Big part of cognitive challenges I see is managing medications. And so this is something I will focus on more in my presentation today, but often people have trouble understanding which medications to take at which time, just organizing the medications, remembering to take them on time, all of those things. Another area that cognition comes into for function is household things. So cooking, for example. So there's multiple layers as of why this happens, but sometimes there's safety risks involved in cooking. So people forget that they have a burner on, or they cook something too long or not long enough. They get confused with adding ingredients at times. And that sort of slowly happens over time in my experience. Cognition also impacts our mobility and can put us at higher risk of falls. And normally this comes back to the brain's ability to multitask. So again, if you're even just thinking about something, your brain is no longer focused on your feet. And then that's when people are more likely to trip and fall. Sometimes people have a reduced awareness or a reduced safety awareness of what's going on around them. So they may do things that seem really risky or unsafe. It's not intentional. It's often related to just how the brain is functioning. And lastly, I just wanted to touch on wandering. So wandering is simply when someone walks away from their home or their car and gets lost. Wandering could also be, sometimes I see this with people go out for a walk and they get confused and then they can't find their way home. And so I will talk about some strategies that can help with wandering as well. Before I go on, I just want to remind you that while some people with Parkinson's will have cognitive changes, it's very important to remember that your intelligence has not changed. You are just as intelligent as you've always been. The challenge is more around how the brain is functioning. And so I remind people of this because we want to sort of dig deep into the intelligence that you have to help us with these problems. Okay, so, oops, there we go. Okay, so what do I do? How do I do my assessments? So it's quite complicated when how I think about my assessments. If I were to meet you in person, my ultimate goal is to make it seem like it's a conversation, because that's where I'm able to build a relationship with my patients to try and figure out ways to help them. Generally, my assessment starts with some sort of history, medical history. So I have often it's from the doctors as well as talking to you as a patient and your family members. And I do this to sort of get an understanding of how you have managed in the past and how you're managing today. Also with this, I do look at all of your medical history because there are times where cognition can be, problems with cognition can be related to other medical problems as well. And so I want to make sure that I have a good understanding. Occupational therapists are able to do both standardized and non-standardized assessments. So standardized assessments for cognition are generally cognitive screens that OTs are doing. So these are short tests, somewhere between 15 to 30 minutes normally to complete them. And I always look at, for a cognitive screen, is when are they needed and when is it appropriate? So there are times where learning what your baseline is. So a baseline is how is your brain functioning today? Not yesterday or not tomorrow, but just how is it working today? Sometimes that's helpful. I also find that sometimes how people are present themselves. So people can look quite well, but then as I start to do some of the testing, some of the problems can show up that way. Cognitive screens, a couple of, you probably have heard of some of them, but the most common ones are the standardized mini mental exam and the MOCA, which is the Montreal Cognitive Assessments. Those are probably the most common ones. And certainly there's other people that can do the cognitive screens as well. Your doctors, nurses, social workers can also complete them. And my physio colleague also does cognitive screens as well, depending on the situation. And if she's seeing the patient and I'm not, that's a great way to help. Another form of testing is neuropsychological testing, or we often refer to this as neuropsych testing. This is much more complex and it's generally done by psychologists in the community. The reason that people would be referred for neuropsych testing is if they're needing help to figure out a diagnosis, or if they are working and they need to figure out if somebody's able to do their employed job. Those are some of the reasons. And certainly patients from my clinic are referred to those at times. And so you may hear of that as well. Now, the big area that I mostly focus on is functional assessments. And so functional assessments is purely how are you managing doing things? I have two acronyms up on the screen. The first one is ADLs. So ADL stands for Activities of Daily Living. And activities of daily living are things like getting dressed, going to the bathroom, taking a shower, all of the personal care pieces of it. IADL stands for Instrumental Activities of Daily Living. And these are bigger things like grocery shopping, managing your household, paying your bills. They're the other things that we do in our lives. The other thing I do for assessment is I will do mobility assessments. So I will do balance assessments, walking assessments, and generally my focus is on how are you managing walking and doing a cognitive task at the same time. So I will use assessments where I have you do a short walk and you have to say the alphabet, skipping every other letter. And I know many people will say, well, that's so hard for everyone. It may seem that way, but if our brain is fully functioning, we are able to do it. And of course, we have data from research that tells us what the average would be for someone with Parkinson's versus someone without. And so that gives us a guideline of how someone's coping at home. The other thing I do with the mobility assessments is I normally repeat them at every visit because it gives me a better idea of how people are, if there's been change or how people are coping at home again. Okay, so now that I've talked a little bit of some of the problems that people can have, today I really wanted to focus on strategies to help with cognitive challenges. And I should mention that, cognition is, there's a sort of a scale. So we have minor problems all the way up to more severe cognitive challenges. Minor problems are things like you forgot what you ate that day, you missed an appointment, you might miss your medications, a couple of times. And then if cognition declines further, people start to need a lot more support. And so I'll talk about different levels as we go along. So biggest strategy is to reduce distractions. So if you're trying to have a conversation with a person who has Parkinson's, it's a good idea to turn the television off. If you have the radio on, if they're doing something and you're trying to have an in-depth conversation, probably not a good time to have that conversation. So just sort of reducing the distractions and choosing a time when it's good to have a conversation. We always in our clinic, I think all of us on our team, we really encourage people to try and focus on one task at a time. And generally my first instruction is if you're up and walking, our focus has to be on our feet. So there's actually research that was done, oh goodness, probably close to 15 years ago, that showed people holding onto a walker and walking. And then if they had a fall, their focus was on holding onto the walker. Or if they were holding a cup of coffee, their focus was on making sure that cup of coffee didn't spill. And so you can imagine that if you are doing more than one thing at a time and you start to trip and fall, our bodies can't even respond to the fall because we're focused on the other thing we're doing. So try and do one thing at a time. The other thing is trying to finish one task before starting another. I hear this quite often that people have multiple things on the go all at once and they never really finish a task. So this is something we can work on though, is to finish up one task before we start something else. So if you're in the kitchen cooking, finish up that job before you go on to do something else. Making a to-do list can be extremely helpful to help with organizing your schedule. Now, to-do lists can look very different for individual people. Some people like to have a daily list of what am I doing today? Some people also have, what they might do that week or even that year to sort of give a better idea of what are things that need to be done and when do they need to be done. If you're able to do a list on your own of the things you need to do, that's fantastic. And I encourage you to do that. If people are having trouble coming up with their lists on their own, that's a good way to sit down with your family or friends to sort of write out the things that you need to get done together. And then have a system. Some people like to cross off their list, some people check it off. But often I find to-do lists are really important because no one person can remember all of the things they need to do. Also with making a list is keeping a calendar. So calendars were designed to help us remember things. It's a memory strategy. I have multiple calendars. I have my personal calendar on my cell phone. I have actually 2 calendars on my work computer to try and keep things sorted. The other things that calendars do is they help orientate us to what day it is. And I know that when people are no longer working or retired, it's not always important to know what the day is, but it does help with our orientation. Because if every day sort of flows into another, we can lose track of what's going on in the calendar. Another thing that can be helpful is labeling things. So again, this is probably be more towards people who have more trouble with cognition. So in the kitchen, some people will label drawers and cupboards. And this label could look like a word. So you could have utensils. Or some people will put a picture up so they can see what is in the cupboard, for example. And this works in the bathrooms as well. And then the last general strategy I have is using signage. So sometimes in your home, it's helpful to have things as a sign as a reminder. Now, you don't want to have too many signs, for example, because then we just stop focusing on anything. But one really important sign is a post-it note that says focus on your feet, because sometimes it's just that little cue that is enough to remind people to focus on their feet first before they start moving or before they're doing something else. Okay, so all related to cognition again, I want to talk about some strategies to help with your personal care. So this is your ADLs, the activities of daily living. So first thing is when you're getting dressed, sit down if you can. A chair is best. The bed is another option if that works. But when we sit down, we are reducing the demand on our brain to multitask at the same time. Because remember, when you get dressed, it's also a balance challenge. And so you want to be as careful as you can, and sitting down, always a great thing. My colleagues and I, we always talk about this, that when we get dressed in the morning, it's often very early, we lean against things, we sit down because we don't want to fall either. Another thing is to wear easy to wear clothing. So things like pullover shirts, elastic waist pants or shorts, just to make the demand on the brain a little bit easier. Some people also, actually, I would say everybody could benefit from using a grab bar in their showers. Not just people who have balance problems, but we all could benefit from that. And again, using those tools just reduces the demand on the brain in a safe way. The other thing is showering around the same time every day. And it's all about having a routine, and I'll talk about that more. But having things where you do them around the same time often helps with how our brain is working, so that we have we know what's coming next, sort of thing. Okay, so big topic that I come across is medication. So I'm guessing that most of you already know that with Parkinson's, it's very important to take your medication on time, every time. And so I often work with people to try and find strategies to help with this. And so I have a couple I want to talk about today. The first is alarms. So there are many ways to have alarms. Alarms could be on as simple as an alarm clock at home. It could be a watch, it could be a cell phone, it could be the microwave timer. Alarms can work really well, but the challenge with alarms is when you hear that alarm, you need to stop what you're doing and go take your medication right away. Because quite often I hear, well, my alarm went off, but I was doing something else, so I didn't get up to take my medication, and then realized 3 hours later I had missed my medication. So it's all about that routine. You hear an alarm, you go take your medication. Often with, especially if you're out of your house often, I highly recommend that you have some sort of container to carry your medication with you so that if you're out, you can take it. Reminders can also help from a family or friends to help you with those medications. And I should mention that some people need alarms for every dose. Other people need alarms for just specific doses in the day. In my experience, it's often the afternoon medications that get missed because people are busy doing things. And so we want to have a way to help remind on those ones. Routine, as I had mentioned, is really important around your medication. So if you're at home, keeping your medication in one spot, having a glass of water next to your medication so that all you have to do is get up, water's already there, and take your medication. Medication organizers can be very helpful, and there are many different formats for this. Some people have just the basic plastic organizers. I have yet to find one that has more than 4 or 5 potentially doses per day. I'm always on the lookout for one that has up to probably about 8 times a day for some people. But an organizer can help where somebody, either yourself or a family member, is putting the medication into the time slot. If that isn't working, and some people might take the wrong dose or the wrong day of medication, blister packs is the next step. So blister packs are done through your pharmacy, and they have a label for the day and the time, and then you push it out. Now, there are some newer blister packs that some pharmacies are doing, that some are electronic. So it connects to an app that will tell you, and there's a little sensor in the blister pack that will tell you if the medication was taken on time and which little pocket it's come out of. Because that can be helpful if you have a family member that with Parkinson's, but you don't live at their house, you can help with them that way. Blister packs, one last thing about blister packs is some pharmacies will charge for blister packs. And if finances are a challenge for you, I recommend calling around to different pharmacies to see if there's ones that don't charge for them, because the price can start to add up really quickly if they're charging per pill in the blister pack. Last thing I want to mention about medication is there are automatic dispensers for medication. Now, I know in Fraser Health, there's certain communities where the home health program can help set this up. Other times people purchase devices online or in medical stores that you would set up ahead of time, and then it has an alarm, and it has they all vary, but medication is dispensed from the container at the specific time you need it. Some of them have alarms, and it's set up that you can't move on to the next dose until you've taken that dose. And so I find with medication management, it's really about trial and error and trying different systems. There is not one system that works for everyone. So keep that in mind. And so I always say, if your system is working, don't change it. But if it's not working, then we need to look at other options. Okay. So a few things about some cognitive strategies for household management. So first off, just finances and bill payments. So there's a couple of options. Some people benefit from automatic payments for bills. So if you have like a lot of household bills, you can now have automatically withdrawn from either a credit card or a debit card. And so this eliminates the need to every month stay on top of it. I know even for myself, there are months that I miss the date of bills. And so I keep trying to remind myself to set up the automatic payments. The other thing to look at is how your bill is delivered. Some people prefer to have it as a paper bill because it comes to the house, you open the envelope and you can see it right away. Whereas other people benefit from it coming from over email, especially if a family member is helping with bills, then it can go to email and you can search it that way. There isn't one way that you need to do it, but just think about the options for how to do it. Some people start to benefit from help from family to help with bill payments, or friends, I should mention. And of course, you want to do this with someone that you trust and that can help you where you need their help with. I also just wanted to mention about power of attorney. Power of attorney is for finances. And so that can be set up. I actually recommend everybody ideally has a power of attorney set up. And there's different types of power of attorney. And the idea is that if you needed help with things like your bill payments, your power of attorney could assist with that without having to go through the court system. And so that's something that you want to think about over time. Another thing I wanted to mention about was grocery shopping. So again, this is a task that I actually encourage people to be part of because it's a weekly task that we have done most of our lives. Now, if you've never done grocery shopping before, maybe not the right time to start. But making a list for grocery shopping, it involves that executive functioning. So you're planning ahead. You're thinking about what you're going to make. So writing out a list can be a great way to start with that. I highly recommend keeping meals really simple. There is no need to have gourmet meals every day. And so you want to do things that work for you. The other thing is there are plenty of meal and grocery delivery services now. And I think one positive thing to come out of the pandemic is that there are many more services now for things like this. And so sometimes that can help with even some of the meals for the week, so that it offloads that demand on your brain and your body to do all those things. Okay, so as I said, I wanted to talk a little bit about safety. Safety is, of course, one of my top concerns, always. Safety for the person with Parkinson's and also for your families. So just a little bit about home safety. So there are many ways to try and keep your home safe. In our kitchens, there are things like stove guards that block the knobs on the stove. There are setups now to disconnect or turn the stove off if you're leaving the home and your family member is still there. There's things like even tools that in the kitchen. So there's different types of knives and scissors to help with cutting and chopping that make things a little bit safer. In the bathroom, lots of safety features around in the bathroom to help with how the body is moving. And again, if cognition is impaired, how the body moves will likely also have a problem. So everything from grab bars to shower chairs, benches for bathtubs, toilet setup, lots of different tools out there. What I always recommend when it comes to equipment is try them out if you can, see how it works, and do a little bit of research or working with if you have an occupational therapist or with your team to try and sort out what might help. I always sort of use caution around trying out too many things all at once because we don't really always know what's working and what's not. Some wandering strategies. So if you or your family members have the potential to wander away, there are many different systems now. So the most simplest is a bell on the door, that if the door opens, you can hear if someone's leaving. There are watches, there are insoles and shoes, or cell phones that all have, and alert systems that have GPS locations on now. And so often I have people, if someone uses a cell phone and they're going out and there's a potential for wandering or getting lost, I always say, look at the cell phone first. If it's an iPhone, you can do Find My Friends. And then you can track where your loved one is so that if they don't come home when you're expecting them, you can just look up and see, oh, they stopped to chat with a friend, or maybe you need to go and help them. Planning for emergency situations. So when, I'll come to this in just a moment, but stress makes the brain function decrease. So in an emergency situation, people can forget their names, their phone numbers, where they live, even their family's names. And so we want to make this as easy as possible. I always suggest carrying a card in their wallet or a pocket that has their name and an emergency contact. There's also medical alert bracelets you can use to try and help with that. And lastly, about safety is decision making. So if you're having cognitive challenges and you need to make big decisions, such as moving, making big financial decisions, talk to someone you trust. Have a conversation about, is this a good decision for me now, or what are some other options? Just to make sure that you have that support to do those things. Okay, so the last couple of slides I have here is talking about other things that impact cognition. So I'm going to talk about sleep, stress, hydration, brain activities, and exercise. So sleep is the first one. I find that sleep is, in our culture, sleep is underrated. And what I mean by that is that our world is sort of functioning at a go, go, go all of the time. And people are not getting enough sleep or good enough sleep. And so what I really encourage is you to take a look at your sleep habits and routine and to see if that may actually be contributing to how your brain is working. I can tell you that if you're getting 3 or 4 hours of sleep a night, that is definitely not enough for your brain to recover, and you will see problems the next day or 2 days later. There's a lot of research out about how many hours someone needs to sleep. It really does vary. I would say in an ideal world, most adults would function well if we got somewhere between 8 to 10 hours of sleep. And I imagine that a lot of you are not getting that much. And so we want to take a look at some strategies, but definitely if you start to sort of track it, you may see that when sleep is poor, it impacts how you're managing the next day. People tend to have more falls, brain doesn't work as well, more trouble with memory. Some reasons that people have problems with sleeping. Of course, I'm not going to go over sleep disorders, but there are different types of sleep disorders that are fairly common with Parkinson's. So that would be something to talk to your doctor. Other things are pain, bladder problems. People have trouble falling asleep, going back to sleep. And so there are many reasons why sleep can be disrupted. Some things that can help with your sleep. So first off, if you're having bladder problems, so if you're getting up to the bathroom, I would say if you're getting up 3 or more times a night, absolutely talk to your doctor. Find out if there's another reason that you're needing to use the bathroom that often. Again, as you can imagine, if you're getting up to the bathroom 6 times a night, that's just disrupting your sleep. Having a routine can really help with our sleep. So we want to prepare our brain and our body to go to sleep. And part of this is allowing enough time to get enough sleep. So if I only go to bed at midnight, but I know I have to wake up at 6 a.m., I have not given myself enough time to get enough sleep. And so I need to relook at my schedule and what I have going on to go to bed earlier or win the lottery so I can wake up later. Now, I do find that with a routine, trying to go to bed around the same time every night is a good idea, as well as trying to wake up around the same time if we can. Next, I wanted to talk about taking naps. Now, naps can be very important for people. And if you have taken a nap your whole life in the afternoon and that works well for you, I'm happy for you to continue. If your naps are starting to be 2-3 hours long in the day, and then you're having trouble sleeping, that's when we want to look at how much you're napping. In general, I would say limit your nap to 1 hour or less so that it allows you to sleep better at night. Just checking the time. Okay, another thing is relaxation. So this is part of this routine, setting our body and brain up to go to sleep. So this could look like reading something quiet, doing meditation, things that help relax your body. How our room is set up affects our sleep. So if your room is too hot or too cold, that can be a problem. If you have a lot of items in your room, that can be a distraction and not allow the brain to settle. So keeping your room nice and tidy can help. Exercising during the day helps us feel tired enough to sleep well. So exercise is super important for our sleep. And remember, all of this is about trying to help your brain function well. The last thing I'll mention about sleep is exposure to daylight. So there was a little bit of research that came out about a year and a half ago around getting daylight that helps our sleep. So if we can get at least 30 minutes of daylight, that can help us sleep. I wish I could say living in BC that we would all get sunlight every day. Unfortunately, we live in a rainforest, so that may not happen, but just daylight, it helps to reset our sleep and wake pattern. Okay, next up is stress. So stress absolutely reduces how our brain works. And so this isn't just for people with Parkinson's, this is for everyone around the world. When stress is high, our brain function goes down. Often this looks like problems concentrating, memory can be a problem, and people have more confusion if stress is high. I will mention that stress is, again, it's a complex situation for many people. But what we want to do is we want to try and manage our stress. So it's not about reducing or eliminating all stress. It's just trying to reduce it and manage our stress so that we're coping as best as we can. So a couple of my strategies are keep your life simple. Life is complex enough already. I always try and just keep things as simple as possible. We want to work at reducing the things that are causing us stress. Now, there are things that we can't always change. Relationships are one of those things that we're trying to manage how our stress is, and because it's unlikely we're going to change other people. And things like where you live, your finances, we can't always eliminate those problems, but we can try and cope with them. As I had said, relaxation helps with stress, exercising, having a routine, and mindfulness. Mindfulness is linked with meditation, but mindfulness is just being aware of how your body is now to allow your stress to come down. I highly encourage you to reach out to your healthcare team, connect with the Parkinson Society's PD Connect for counseling, connecting with friends and family, and possibly looking at home support if depending on what your needs are to help manage that stress level. Okay, hydration. So how much we drink impacts how the brain works. So the way I normally describe this is our entire brain and spinal cord is covered in water. So if we're dehydrated, our brain cannot function at the same level as it would normally. So we need to drink more water. And I would say most of us, even myself, we can all drink more water in the day. A couple of things that can help, and again, routine is part of this. So if you're having cognitive challenges, sometimes people stop drinking and it's hard to encourage them to do that. So strategies, have 2 glasses of water when you wake up. This can help with how the brain is working. And we've seen a big improvement in people's dizziness and low blood pressure if you can drink 2 glasses in the morning. And then the other sort of trick I have is having a glass with every meal and when you take your medication. So instead of just a few sips of water, if you can try and drink a regular glass of water, you'll probably feel much better. And of course, if you've been told by your doctor to restrict your fluids, please follow those instructions. And I do recognize that if we're drinking more water, we're probably needing to go to the bathroom more often. And so I know that some people will restrict water or fluids for that. The challenge is, like I said, our brain does not function well without water. So we need to find a balance somewhere in there. Okay, brain activities. It's really important to keep our brain busy and doing things. Often with Parkinson's, people have had a restriction or a reduction in the things that they can do. So we want to find new ways to keep your brain busy. So this could be reading, or I really like audiobooks or podcasts to listen to things. Listening to audiobooks is different than watching television. TV is very passive. We don't do a lot of thinking when we watch TV. But when we're listening to an audiobook, our brain still has to focus on the storyline. Playing games is another way to keep your brain active. Any type of game, anything that you enjoy, play a game. Word searches is another thing. Or if you can do crossword puzzles, anything that gets your brain working. And social interactions. So over the last year and a half, during the pandemic, I have unfortunately seen a significant change in people's cognition. And I think it's really related to the increased stress and the reduced social interactions. So all those little interactions that we have when we're out of our homes, it really does help our brain. So whatever way you can interact with other people, of course, I encourage you to stay safe during the pandemic, but whether it's over the phone, over video, or at a safe way where you're seeing people in person, interacting with people is really important. The other thing is finding something new or learning something new is so helpful for our brain. So if there were hobbies in the past or things you wanted to try and you just never did, now is the time to try them. I have lots of people that start painting that have always sort of had an interest and now they have the time. Painting is a great way. We are not looking at creating art that you will become, the new artist. It's about art for yourself and doing things for yourself. Okay, I couldn't leave this without talking about exercise. So I know in the traditional medical world, a lot of occupational therapists don't talk about exercise, and it's more so left to the physiotherapist. The challenge is I see a huge difference in people who are exercising with how the brain functions. When we exercise, we are pumping blood throughout our body, including our brain. And this is what can help our brain function. Exercise for Parkinson's has also been shown to use the dopamine that you have in your brain to help your body function better. So while you may be taking medication to replace the dopamine, when we exercise, we use the dopamine that's in your brain as well. Exercise helps us keep a routine and sort of expectations for the day. So I always encourage to schedule exercise like you would any other appointment. And so choose a time that you'll do it and a time that you feel good. Don't wait until the end of the day when we're all more tired to try and go for a walk, unless that's part of your routine. Exercise also helps with our mood. And when our mood is better, our brain will work more and we'll have more interest in things. Of course, exercise helps with our strength and balance, which can help with that multitasking. So the stronger we are, the less likely we are to fall. As I said, when we exercise, it helps us sleep better. We've released that energy in our body to allow us to sleep. And most importantly with exercise, I always suggest start small and build over time. If you have access to a healthcare worker that can help you building an exercise routine, The Parkinson Society has some really great exercise opportunities, and always encourage you to reach out and find out something you enjoy and something you'll stick with. Last thing I'll say about exercise is all movement is good movement. So you may not feel like you're doing enough for exercise, but remember, every step you take in the day is good movement. And so if all you're able to do at this point is walk around your own home, that's great. We'll build that over time, but just start getting up and moving. So I know you've probably all been sitting. I've been standing, if you can't tell. This would be a good time as I'm finishing up is to stand up and move around safely, of course. Okay, so the last few things I just wanted to go over, my take-home messages, is to help your cognition, we need to keep your brain active, find things to do, and work with your family and friends for ideas if you need help to do those things. Try to get more sleep or better sleep. Drink more water. Keep life simple and reduce stress. Ask for help when you need it. Exercise, move your body to start moving. And of course, please talk to your healthcare team for support. I sort of consider myself a professional problem solver. And so I'm always happy to hear from patients and families if there's concerns, because I want to try and problem solve around things so that we can make life easier, safer, and more enjoyable. Okay, so that is the end, and I apologize, I went over a few minutes. Hopefully it wasn't too long. I'm just gonna stop sharing, and then I'll be able to answer some of your questions. Okay. Oops. Okay. So one of the questions, how does a Parkinson's patient access Fraser Health OT services to be assessed and receive care? Okay, so if you are a patient of one of the neurologists that I work with, and I'm in Surrey, everybody is welcome that is part of our clinic to access my services. If you're not part of the Fraser Health program, then we're looking at either home health occupational therapists, or there are some occupational services through outpatient rehab at different hospitals. So the best thing would be to first find out if the doctor you're working with has an occupational therapist. If not, it would be actually to call Fraser Health Home Health Services, and then ask for occupational therapy, and that would be the first step to try and get someone. Hopefully that answers that question. Okay, any other questions? Okay, so a question is, do you need a specialized occupational therapist in Parkinson's to get the relevant help for Parkinson's? So I wish that I could say that there are specialized OTs. The short answer is no. I'm probably, I know I'm one of the only ones in Fraser Health that works directly with Parkinson's patients. But with that in mind, our goal as any occupational therapist is if they don't have the information, we should be looking for the right contact. So I have occupational therapists that contact me for more information as well. But there isn't a specialized program specifically for OTs. I have had the opportunity to attend some really great education over the years that has helped to build my skill set. But no, the short answer is no, you're probably going to get an occupational therapist that sort of does general care for patients. Sometimes the outpatient occupational therapists, they have a lot more knowledge about neurological conditions. and Parkinson's is one of those.
Lisa, we also have a question from Brad, who's raised his hand, so I'm going to let him ask.
Yep.
Go ahead, Brad. Brad, you're muted. You'll have to unmute yourself.
Oh, there. Is that better?
Yep.
Okay, great. Thanks. Brad's not speaking, it's Barbara. We're together here. We've enjoyed this afternoon. Do you have a cheat sheet that we can look at and just go over? You gave a lot of information here, and I was just wondering if there's the cheat sheet that you have that we could get a hold of.
So no, I don't have a cheat sheet, but I'm happy to put one together. So it just might take me a couple of weeks to get that back to Alana, and then, but I will happily do that for you.
Oh, good. Thank you.
And the slides will also be posted on the website along with this webinar.
Yep.
Oh, well, that would probably be sufficient if we could just to get them access the slides.
Yep, absolutely. You have the slides, but that's a really good idea, though, to have a cheat sheet. I have one from many years ago on memory, and I'll modify it and make it a little bit more appropriate for Parkinson's. Absolutely.
Okay. Thank you.
Yeah.
Thank you, Lisa.
Okay.
Publish our information too when we register.
Yeah.
Okay. Any other questions today?
Hello.
Yes.
Do you have our address for you to mail out the cheat sheet?
Alana, are you able to help with that at the end?
If she sends it to me, I can email it to everyone who attended today.
Yeah, I'm happy to do that. Will that work, Brad?
Yes, yes. Okay. Receive it by email.
Yes, okay, good. Just one other question, question about golf. Am I aware of any Parkinson's groups like golf? I'm not. This is something that I've had other people ask me about. I'm not aware of any Parkinson's groups. I don't know if the Parkinson Society knows of any. That's a good question. Is there a group that, you know, to set up that people would go out together that might be moving a little slower and take more time on each hole? But I'm sorry, I don't know of any that do that right now.
So she'll send it to our email.
Yeah.
Brad, could I just ask you to mute, please?
Oh.
Oh, I got it for you.
Oh, there we go. It happens to all of us.
Okay, well, I don't think there are any more questions. Lisa, I want to thank you so much for putting on a very helpful and informative presentation. And thank you everyone for attending. And before you go, just a quick reminder that registration for our Moving Forward Together Provincial Conference is open. So you can check that out on our website. So thanks very much, and see you at our next webinar in this series with SLP Jamie Russell, who will be speaking for us on language impairment as it relates to cognition changes in Parkinson's. Have a good afternoon, everyone. Bye now.
Take care. Bye-bye.